Welcome to the PTCB Prep Guide. In this explainer, we are breaking down the absolute fundamentals of drugs. These are the core concepts you really need to know to walk into your exam feeling confident.
Oh, and a quick heads up before we dive in, don't forget to check out the description below. We've got links to practice questions and flashcards to help you really nail these topics.
All right, so what are these essential concepts we're talking about? Well, think of them as the building blocks of pharmacology, the stuff that shows up all the time on the exam. Understanding them isn't just about rote memorization, it's about truly grasping how these medications actually work.
So here's our game plan. We're going to start with drug names and how they're categorized. Then we'll explore all the different dosage forms. After that, we'll clear up what therapeutic equivalence really means. And finally, we'll untangle the difference between pharmacodynamics and pharmacokinetics. Let's get right into it. First up, a drug's identity. We're talking about how we classify it and, of course, how we name it. Getting this part right is absolutely fundamental for pretty much everything else you'll do as a pharmacy tech.
At its core, drug classification is just a fancy way of saying we organize drugs into groups. Think of it like a library. We put books together by genre, right? Well, we group drugs together based on either the condition they treat, that's their therapeutic use, or how they actually work inside the body, which is called their mechanism of action.
For instance, antibiotics, like amoxicillin, are all grouped together because they all fight bacteria. Simple enough. Antihypertensives, like lisinopril, they're all used to lower blood pressure. Some other huge categories you'll see constantly are analgesics for pain, anti-inflammatories, and antidepressants.
Okay, so now let's go from those big groups down to the individual drugs themselves. Here's a key fact. Every single drug you will ever handle has not one, not two, but three different names.
Let's use a super common example to make this stick. Tylenol. First, you've got the chemical name. It's long, it's complicated, and honestly, you won't use it much. It just describes the drug's molecular structure. Then we have the generic name, which is acetaminophen. This is its official, non-trademarked name. And finally, there's the brand name, Tylenol, which is just the catchy name the manufacturer gave it for marketing.
So here is the crucial takeaway for your exam. Listen up. Acetaminophen and Tylenol contain the exact same active ingredient. The generic name is the active ingredient. The brand name is just the packaging it comes in, so to speak.
Okay, on to our next section. Now that we know what drugs are called, let's talk about how they're actually delivered to the body. This is the whole world of dosage forms.
The most common way to take medicine is orally, right? By mouth. And that includes the usual suspects, tablets and capsules. But it also includes liquid forms like solutions, syrups, and suspensions. And these are super important, especially for kids or patients who have trouble swallowing pills.
Now let's zoom in on a really key difference: solution versus suspension. In a solution, the drug is completely dissolved in the liquid. It's totally clear. But in a suspension, tiny particles of the drug are just floating or suspended, and they can settle on the bottom. And that's exactly why that Shake Well sticker is one of the most important labels in the pharmacy. It ensures the patient gets the right dose every single time.
All right, let's move on to injections, or what we call parenteral forms. The main thing you gotta know here is the speed of action. Intravenous, or IV, is the fastest, no contest. It goes straight into the bloodstream. Intramuscular, or IM, into the muscle, is next. And then there's subcutaneous, or sub-Q, which is just an injection right under the skin.
And of course, there are so many other forms out there. You've got topicals, like creams and patches that you put on the skin. There's suppositories for rectal or vaginal delivery. Inhalers get the medicine straight to the lungs. And of course, drops for localized treatment in the eyes or ears. So this brings us to a really, really important question, especially when we're talking about substituting brand and generic drugs. Are they actually the same? The official term for this concept is therapeutic equivalence. For a generic drug to be considered therapeutically equivalent to its brand name counterpart, it has to meet some really strict criteria set by the FDA. As you can see, this means it's got to have the same active ingredient, the same dosage form, the same strength, and be given the same way. All four have to match.
So how do you know for sure if two drugs are equivalent? Well, the go-to resource, and you should definitely burn this into your memory for the exam, is the FDA's Orange Book. It is the official guide that lists all the approved drugs and their therapeutic equivalence codes. It's the pharmacy's Bible for this stuff. And for our final section, we're going to tackle two terms that sound similar but are totally different: pharmacodynamics, and pharmacokinetics. This is all about that two-way street, the interaction between a drug and the body.
I know, these words can sound a little intimidating, but there is a super simple way to remember the difference. Pharmacodynamics is what the drug does to the body. Think D for dynamics, D for drug. Pharmacokinetics, then, is what the body does to the drug. Just remember those arrows, drug to body versus body to drug.
So, let's dive a little deeper. Pharmacodynamics is all about the drug's effect. It's how that drug molecule finds its target in the body, maybe a receptor, and causes a change. For example, a blood pressure med might target receptors in blood vessels, causing them to relax, and poof, blood pressure goes down. That's dynamics. Pharmacokinetics, on the other hand, is the journey that the drug takes through the body. And we have a great acronym to remember it. ADME. ADME. A is for absorption, how the drug gets into the bloodstream. D is for distribution, how it travels through the body to where it's needed. M is for metabolism, where it gets broken down, usually in the liver. And finally, E is for excretion, how the body gets rid of it, typically through the kidneys. ADME. All right, let's do a super quick recap of the absolute must-knows from today. First, drugs are classified by what they do and have 3 names: chemical, generic, and brand. Second, dosage forms are all about how a drug gets delivered into the body. Third, therapeutic equivalence means brand and generic drugs work the same, and you can check it in the Orange Book. And finally, remember, pharmacodynamics is the drug's effect on the body, while pharmacokinetics is the body's effect on the drug.
We've definitely covered a lot of crucial ground today. So, take a second and think about your own study plan. Which of these big ideas, classifications, dosage forms, equivalence, or ADME, do you think you'll want to focus on reviewing first before exam day?
If this guide was helpful for you, please do us a favor and hit that like button and subscribe for more content just like this. Thanks for watching the PTCB Prep Guide, where we're simplifying pharmacy one topic at a time.